You've been putting up with hip pain, you're struggling, you've had your MRI, you've been waiting for it and it's come back as normal and you're back to square one, figuring out what to do. We're going to dive into that in this video. MRIs are abundantly available, right? This is something that's so useful. And we're going to really kind of in this video dive into some of the pros and cons of this type of imaging, because I really want to, I'm here for the patients who are struggling with hip pain, right? And I'm here to back you up. I'm here to support you and give you a little bit of insight to the context of what sometimes is missed or not really explained to you, especially when you're in a quick appointment with a surgeon or a doctor or even with your healthcare practitioner. And I want to dive into this now because ultimately people who have hip pain can struggle with pain chronically. And this is probably my bias, right? Because all day, every day, I see hip patients. So I see the impact that chronic hip pain can have on someone's life. I think a lot of the time people think chronic pain is like your lower back or your neck. Guys, people who have persistent groin and hip pain are living with an impaired quality of life for so long. And it really frustrates me that sometimes the management isn't up to par or that their patients are just not listened to. This is partly essentially why I'm doing this. This is to share some awareness, a little bit of kind of insight into what we need to be doing better. But this is it, right? If you've had hip pain and groin pain for a particularly long period of time, right? Even if it's a number of months, living with pain is not fun. You know, you've got to think the impact on your quality of life is really quite poor. That's not good enough. Lowering your expectations because pain has altered or distorted your perception of what should be normal or what you need to put up with. That's not normal. Normal is not having any pain. So, but when someone has hip pain for a prolonged period of time, months and months and months and years, that becomes normal. And sometimes what can happen is that individual is stuck. They're stuck. They're thinking, what do I do? Where am I meant to go? What are my options? Because I'm stuck. Because one person said one thing, one person's diagnosed another, someone else has said, don't listen to that one. Stuck in the middle thinking, what the hell am I meant to do? Well, within all of this stuff, sometimes within that mix is imaging. I'm not against imaging. I think imaging in the right hands, in the right context, is obviously essential in the management of some people. Now, I wouldn't say it's essential as your first port of call, far from it. But it is essential at understanding some of the things that we need to know. But imagine you're that patient. You've had hip pain for a year. You've waited months and months and months to have an x-ray, to have an MRI, and you've gone to have it thinking, right, this is the step. This is my first step back to recovery. And then you go and have the report and the report says it's normal. I mean, talk about a kick in the teeth. You're thinking this isn't normal. I'm in pain. There's obviously something there going on, but the MRI hasn't picked it up. But my physio said that I've probably got a labral tear. Well, you know, your MRI's come back normal. But that surgeon, that physio said that they thought I had hip dysplasia, but the x-rays come back normal. Imagine how demoralizing that is for a patient. Now, don't get me wrong. I'd rather your scans came back clear. No one wants to have anything weird and wonderful or sinister or bad or pathologically wrong with themselves, but we're looking for answers. And this is telling us that there's no answers. Having already had the delay for access in a lot of cases, not everyone's got the luxury of private healthcare. So sometimes you have to wait and get the referrals and then you go and it says it's normal. But you've got that patient in front of you or you are that patient. And that is a real kick in the teeth. But there is some caveats to this stuff that I want this video to really dive into, because let me explain this to you. You could go for an MRI scan for your hip to try to identify the thing that's causing your hip pain. Now, a lot of the time, someone might be getting hip pain because of their labrum or a labral tear. And you go for an MRI, have the scan, come back and it says it's clear. That does not mean that you have no labral injury. There are two types of MRI strengths or machines. You've got 1.5T and 3.0T. Now, traditionally, most of the places that you go to have the prior 1.5 Tesla MRI machine. I'm not a fan of MRI. I hate it, you know, lying on the tube and going in. But the good thing is the 3.0T ones, they're a bit bigger and they're a bit quicker. But with that comes the price that you pay for a more advanced bit of kit. So most places have the older traditional MRI machine. Now, they are not 100% accurate or sensitive at picking up an intra-articular defect or the kind of structure within the hip joint, because it's a deep joint. There's a lot to get through to have a look at that. And we're trying to look at one small part of the hip. So often patients who have a labral tear go to have a scan and the scan comes back as normal. that's a struggle because they're thinking that there's nothing there, but there might be. It may just not have picked it up. And then you've got this argument, right? You've got this dilemma because you've got an MRI, which is non-invasive, right? So you're just laying there. You don't have to have anything done to you versus an MRA. So an MRA is when you have a dye injected into the hip. You have a dye injected, it's like kind of like glows it up, kind of. It means that then on the imaging, you can see the lining a lot better of the hip joint. So the accuracy is significantly better than MRI, but it's not 100% even yet. And then you've got someone who has hip pain, right? Because no one goes for an MRI when they're pain-free. No one's just standing there thinking, oh, I'm at loose end today. I think I'll probably go for an MRI scan on my shoulder or my hip. You don't do that. You go in there because you're in pain. So what doesn't help your pain is when someone's sticking a needle with dye inside, because it's no therapeutic value to it. It's a dye. It is probably going to be a bit irritable. And also you've got the 0.0 whatever percent of those people who are having dye that could ultimately get, complications from that. And that, someone somewhere is dealing with that. That's not an impossible risk. So then you've got this other argument here, the new baby, the 3.0 sexy new MRI machines that walk into the picture and they say, right, ladies and gentlemen, I'm here. Why are you getting involved? I've got my 1.5T MRI machine. Well, this one is bigger, it's better, it's stronger, it's more powerful, which means that you can see more of the joint, you can see more of the structures, and the risk of not picking up something like a labral tear is a lot more diminished. And it's not invasive, which is great. So the risks that we had with the MRA, albeit low risks, but risks, we don't have it with this one. We've got a stronger machine that's able to do more and see more, which means that the context of this is really important, because as a patient, you need to understand what kind of scan am I having done? Which one of these machines have been used? That's come back and that said it's normal. This one's come back and said it's normal. Do I favor the information I'm getting one from the other? These things aren't necessarily explained to you, but they play such an important role. And it's the same thing when it comes to x-rays. One of the biggest things that I see in my clinic, and my clinic is, I'm lucky to get referrals from doctors, from surgeons, from physios, from all sorts, to see people who have chronic hip pain, yeah? And a lot of the time, these patients have gone through the mill, multiple scans, multiple injections, multiple x-rays, and the things get missed. Really critical diagnoses get missed. And I'm not saying I look at them and I pick them up. I'm just saying they come to me with information that has been diagnosed having had multiple scans or x-rays before. And when it comes to x-rays as well, a key example of that is something called hip dysplasia. This is inherently missed on plain radiographs, especially those who have subtle or borderline hip dysplasia, because sometimes it's hard to pick up. But you've got a 2D image, even if you're looking at multiple views of the hip and the pelvis, we've got a 2D image, we've got someone analyzing it. So, humans are allowed to make mistakes now and again, believe it or not, until those robots come in and start doing our jobs, but not yet. But we've got this key situation here where you're looking at a 2D image of a quite complex joint, right? There's 3D in nature. So things can get missed. And then you think, well, that's why the imaging can be quite useful, because even though a CT scan or like a 3D imaging is a lot more, I guess you get a lot more of the X-ray type risks. Only one is, you get some sort of X-ray type risk factors that you would get also with a CT scan, but also you get way more information. And the most important thing with this is you're not going to miss anything. You're starting to see a far more robust picture. And if you're someone who is struggling with pain chronically and you're trying the physio, you tried the injections and nothing is working, well, really you need to get some answers. But it's understanding the answers that you're getting from the imaging that you've had. Does that make sense? So you're just trying to make sense of what you've been told, because it's such a demoralizing thing for a patient when you're struggling, when you're not sure what to do. You're thinking, right, well, I've had this scan, I don't really know what else to do. And that's a difficult situation to be left in, because there as a patient often feeling a bit lost and you lack direction. And this is honestly, it's frustrating. It's frustrating for the patient. It's frustrating for me seeing it and talking about it as well, because that individual who gets stuck, who doesn't get maybe managed correctly because their scans are saying that they've not got anything wrong. Maybe it's in your head. Maybe we'll refer you to pain management. That is not good management. That is not conducive when it hasn't been robust enough to what they think they've had. And what happens at that stage, that's the kind of patient that unfortunately gets pushed from pillar to post and ends up themselves having to go searching for the answer, searching for another clinician, searching for another osteopath, chiropractor, sports therapist, physio, whatever it might be, in order not only just to get help, but to get someone to listen to them. So like, imaging isn't a bad thing, far, far from it. But the limitations that we have with all of these different things are so vitally important and so often missed that often as a patient or even as a physio, imagine like even the physios that are listening to this, that are referring patients for scans and things like that and MRI scans, may not necessarily even understand the differences between these two things to educate or counsel the patient. So unfortunately, that patient could come back on your caseload, no pain, more pain, still the same situation. MRI is normal, continue with physio. And you're thinking as a physio, looking at the referral patients come back and you're thinking, I've not done something. I've done all the good stuff. I'm not like saved. I've not done all my physio and thought, actually, you know what? I'm going to hold on to this next bit just in case they come back. No one does that. We do all the stuff that we want to do and all the great stuff at the beginning. And if it's not worked, then at that point, we've got to figure out why hasn't it worked? And that's why often you send for these images. So if you're that patient and you're struggling, let me know or reach out and I'll see what I can do to help.